in academia, I've always asked myself, so what? How can this finding be translated to improve, my mom's life or my cousin's life or my neighbor's life? So applied research enables me to translate science into practice and use practice to guide avenues of research.
I'm J.B. Wogan from Mathematica, and welcome back to On the Evidence, a show that examines what we know about today's most urgent challenges and how we can make progress in addressing them. Sarah Lieff wants to know if the Medicaid expansion, which made mental health services more affordable in many states, resulted in greater access and improved quality of mental health treatment for those who need it. Rachel Perera is interested in public policy mechanisms for reducing racial disparities in school discipline, and she's particularly interested in complaints filed to the U.S. Department of Education for civil rights violations related to racial discrimination in school discipline. If a school district is investigated by the Office of Civil Rights in the Department of Education, does it appear to reduce racial disproportionalities in discipline or other student outcomes? Both Lieff and Perera are continuing their doctoral research as Mathematica Summer Fellows. Lieff is a student at the NYU School of Global Public Health. Perera is a student at the Pardee Rand Graduate School. For this episode of On the Evidence, I speak with Lieff and Perera about the questions they're pursuing this summer, what they find appealing about applied research, and how the field they're entering can help reduce racial disparities in both mental health care and education. I hope you enjoy the conversation. So, you're both summer fellows for the summer of 2020 at Mathematica. Tell me a little bit more about what you're working on this summer. Rachel, do you want to go first?
Sure. So broadly, my research is focused on issues of inequality in K-12 education. And one specific topic that I have been focused on in my work is racial discipline disparities. So we know that Black and Latinx students are suspended and expelled at much higher rates relative to their white peers. And this is a problem in and of itself. But we also know that being disciplined in this way is associated with a number of other problems we care about. So for example, being suspended is associated with lower academic achievement and lower probability of on-time graduation. There's also evidence that school suspensions lead to greater contact with the juvenile justice system. And so these disparities are also ones that policymakers want to address. And so I see this problem as racial discipline disparities as closely related to other policy problems we want to narrow. So given this background literature, I've become really interested in thinking about how can we effectively address these long-standing racial disparities in how students are disciplined in schools. And one promising approach for addressing racial disparities that hasn't received much attention in this literature is the use of federal civil rights investigations to address concerns of racial discrimination in school discipline. And this is the focus of my research this summer. And so to give a bit of background as to what federal civil rights investigations look like in K-12 education, the U.S. Department of Education's Office for Civil Rights is responsible for enforcing a number of anti-discrimination laws, including laws that prohibit discrimination on the basis of race. And the central way they do this is through investigations of civil rights complaints, which are typically filed or initiated by parents or groups of parents. And so the aim of my research project is to provide an in-depth look at the federal civil rights investigation process as it is applied to complaints of racial discrimination in school discipline. And so with this project, I am going to do two things. First, I really want to understand how this mechanism is operating in practice. So I'm trying to understand how often are investigations of racial discrimination in school discipline initiated? How long do they last? What's the most common outcome? And importantly, what types of school districts are the most likely to receive complaints or be investigated? So here my goal really is to provide rich descriptive evidence on this policy mechanism. And the second aim of this study is to understand what happens once an investigation is initiated. So here I'm interested in understanding whether being investigated for civil rights concerns has any effect on student outcomes, including discipline rates and racial discipline gaps. And so altogether, the goal of my research this summer is to produce new evidence on how federal civil rights investigations have been operating over the last 20 years, and to assess whether this policy tool is effective in ultimately narrowing racial disproportionalities in school discipline.
Fantastic. Well, I'm really excited to see what you learn. Sarah, do you want to tell me a little bit about what you're researching this summer?
Sure. So, broadly speaking, my research examines the impact of Medicaid income eligibility expansions under the Affordable Care Act on mental health treatment and on racial ethnic disparities in mental health treatment. So we know that a lot of people who need mental health treatment don't get the care that they need. And we know that this is particularly true for racial ethnic minorities. Racial ethnic minorities have lower access to needed treatment, are more likely to terminate treatment prematurely, and experience less culturally responsive care. All of these disparities due to cost, due to stigma, due to the lack of culturally competent providers, and other barriers. So I'm investigating a couple of questions. One, did expanding coverage for low-income Americans and potentially removing affordability as a barrier move the needle on access to and quality of mental health care for people with mental illness? Two, did this vary by racial ethnic group? Did this law have disparate impacts on different groups? And three, how did the barriers shift or come into play here? So on the demand side, how much do cost, stigma, structural barriers beyond cost, how much do those barriers still prevent people from getting the care that they need? And on the supply side, did variation in the availability of mental health providers determine where the law had an impact? So perhaps the impact was greater in counties that have more specialty mental health providers and lesser in counties considered provider shortage areas. So those are the three questions that I'm looking at.
Is another area of variation going to be states that expanded Medicaid versus states that did not? Or I guess you're only looking at the subset of states that expanded Medicaid in the first place.
So that's actually key to my study design. So the way I'm determining the impact of expanding eligibility is comparing states that expanded eligibility to those that didn't. And it's called difference in difference. I look at states that expanded before and after the law compared to states that didn't expand before and after the law. And that way I can tease out what was the impact of the law versus what would have happened in the absence of the law.
Okay. All right. So whenever I'm talking to public policy researchers, whether they're at Mathematica or somewhere else, I always like to ask what the story is behind their going into whatever field they've decided to focus on. What made you interested in your specific research topics? And why don't we alternate? So Sarah, do you want to take this question first?
Sure. So I will tell you about a personal experience I had, and then I'll talk a little bit about how I got to my topic. So I'm interested, broadly speaking, in the social determinants of mental health and mental illness. And when I say social determinants, I mean how a person's mental health and risk for mental disorders are shaped by social inequities in housing quality, in employment opportunities, in work and school conditions. So I became particularly interested in this topic when, years ago, I worked at a large hospital in Brooklyn, New York. I was evaluating a program to integrate physical and mental health care for people with serious mental illness, like schizophrenia or bipolar disorder. And these people were considered high utilizers by Medicaid, high need. I held focus groups with the people served by the program. And through these groups, I learned firsthand about the stigma that prevents them from seeking mental health services and the challenges they experience in searching for jobs and maintaining safe and secure housing. And I learned which services and supports actually make a positive difference for their physical and emotional well-being. So their stories led me to think more deeply about barriers to mental health care. And affordability is a big one, and Medicaid expansions addressed affordability for many. Uneven implementation of the eligibility expansions across states presented a natural experiment to examine the impact of expanding insurance. But beyond affordability, we know that there are many other barriers, and my guess is that disparities will remain without interventions to address the host of other barriers.
Rachel, what about you? What made you interested in this topic in the first place? And sorry, made you interested specifically in your research topic with Mathematica, the focus on school discipline and investigations and complaints?
Mm-hmm. So similar, there are some personal experiences in my background that are informing my broader interest in educational inequality. I grew up in New York City. My family is Puerto Rican and Cuban, and I have a large extended family. And I observed from a young age the variation in educational access just within my own family, depending on where in the city you lived and other resources. And I also saw this in my own neighborhood, where the group of kids I went to elementary and middle school with, we all went different pathways depending on the family resources we had into high school and then college. And so this interest in educational inequality and equity was sort of always present. And then I became more interested in this topic after college when I started working at Teach for America. I spent 5 years there and working in a few different capacities before going back to graduate school. And one of the central reasons I wanted to go back to graduate school is because I wanted to study these topics more deeply and with more resources. And so I came into grad school with this mindset of wanting to study educational inequality and equity. And then I became interested in this topic of racial discipline disparities, in part from some work I was doing during my second year of grad school with my advisor, Dr. Andrew McCacken, where I was responsible for writing a literature review on racial discipline disparities, a task typically given to early graduate students. And through this lit review, a few things were really surprising to me. One, these disparities in discipline, specifically suspensions and expulsions, have been well documented for decades. Particularly the finding that Black students are suspended and expelled at higher rates relative to their white peers has been true and evident in research since the early 1970s. And so we know that this problem has existed for a very long time. And at the same time, we don't know much about what's effective in terms of addressing these disparities. And there's been this flurry of policy action at different levels of government over the last 10 years, but few of these initiatives that have been tried have been successful. And so as a result, for my dissertation research, I became really interested in this question, well, what could be an effective way to address racial disparities in school discipline? And as I was thinking about this, I came across this ProPublica article on federal civil rights investigations in schools. And I had sort of two aha moments reading this article. The first was that this data was available. I didn't know this data was available, and I hadn't thought about using this process to access this data. And the second big aha moment was in this ProPublica article, where they're using and referencing data that they had collected from a Freedom of Information Act. I saw that racial discrimination in school discipline was one large category of civil rights complaints that the U.S. Department of Education receives every year. And so I hadn't thought about that as a policy mechanism that may be effective in addressing racial disparities. And so collectively, this article is what encouraged me to go down this pathway where I started looking into the literature, and then I realized no one had studied this, and that there's really no evidence on the effectiveness of these investigations. And so then I put in my own Freedom of Information Act request, and not knowing really how, timely they'd respond and what this process looks like. I wasn't very hopeful that I could do my dissertation research on this because I was worried I wouldn't get access to data in time, but luckily I was able to get access to 20 years of data on civil rights complaints related to racial discrimination in school discipline. And as you mentioned, this is new data that's serving as the basis for my dissertation work. And so I'm really excited to be able to work on this project, which is also very timely given the national attention towards structural racism in our society, but also using this new information about this process that has been utilized much over the last many decades, but hasn't been studied.
Gotcha. Well, that's great. It's interesting that you both have a clear through line from past personal and professional experiences that connects with the work you're doing today. This question might be a little unfair given that you're still conducting your research, but I was just curious if either of you have been surprised by anything you've learned in the course of your research so far.
So I have a few initial findings that I have found interesting so far, but as you mentioned, I'm still at very preliminary stages of my work. The first big finding that I was surprised by was just how prevalent complaints of racial discrimination in school discipline are. Because this data hasn't been made available, I really didn't have any prior for how many complaints of racial discrimination in school discipline were received by the U.S. Department of Education. And based on some preliminary work, it hovers around 200 to 300 complaints submitted by parents every year around this topic. And that was more than I had expected. And in the data I have, there are almost 2,000 unique school districts that have received at least one complaint of racial discrimination in school discipline over the last 20 years. And that's a pretty large share of public school districts in the country. It's somewhere around 15%, give or take. And so those two things I found really surprising. The second thing that was interesting to me was that most civil rights complaints are not formally investigated, and most investigations close with a finding of no civil rights violation on the part of the school district. And so, again, I didn't have a prior for, what share of complaints ultimately result in some investigation or some finding that there was a civil rights violation. And I was surprised to learn that while there are lots of complaints, most don't ultimately result in a finding that there was some civil rights violation on the part of the school district.
Well, that's really interesting. So you'd already been working on your respective research topics. Why did you decide you wanted to work with people at Mathematica on your topic? Rachel, do you want to take that one up too?
Sure. So I first learned of Mathematica as an organization from my time at Teach for America. In my most recent role, I was working in an internal program and evaluation department, and we had a contract with Mathematica where Mathematica was doing this big evaluation of an I-3 grant that we had received. And seeing what experts at Mathematica did is really what inspired me to pursue this career path. I didn't know what policy research meant. I didn't know really much about this field. I didn't know much about research organizations, and seeing the sort of time and expertise they were able to devote to these big, important questions that we at TFA had made me sort of have envy for the people on the other side of the conference calls. I kept thinking, I want to be on that side. I want to be doing the data analysis, not just sort of reading the report on this side. And so I had this awareness of Mathematica and saw the great work that they were doing in the back of my head. And then last fall, I participated in APAM's mentoring program. So APAM, through their mentoring program, matches students with researchers or faculty, in other words, people who are established in the policy research field. And I was matched with a researcher at Mathematica. And This woman's name is Minbeta Shifra, and she's now my peer mentor at Mathematica. And she is the one who told me more about the summer fellowship program. And so that collectively led me to be interested in applying. And I was also interested because Mathematica is abound in all types of expertise that's valuable for my work. So there are lots of methodological experts, data visualization experts, folks who think a lot about communicating research findings, as well as topical experts who know the school discipline research really well. And so this opportunity has been awesome in terms of being able to leverage all of the different types of expertise at Mathematica to inform my dissertation work and to learn more about all of the interesting and important work going on here.
Okay, great. So Sarah, what about you? What was it about Mathematica that appealed to you? Why did you want to take your research and work on it with our staff?
Thanks. It's really funny that Rachel tells that story about her time at TFA because I have a very similar story. Like Rachel, I was exposed to Mathematica in a previous role in my career. I was the research and evaluation manager for Maimonides Medical Center's health home. So we received a healthcare innovation award that was being evaluated by Mathematica. And while my role at that time was important, I recognized at that moment that I wanted to be doing what Mathematica was doing, determining what was important to measure, to evaluate the program and how it should be measured, and synthesizing data from various facilities to determine what worked and what didn't. Years later, my goal is to use rigorous research methods to evaluate interventions to improve behavioral health care and reduce disparities, and Mathematica is a great place to do that. Specific to my research area, Mathematica has many staff with expertise in Medicaid, who test new ways to deliver and pay for care, who analyze claims data. And Mathematica has staff with deep knowledge of behavioral health policy, so I really felt it was a perfect fit. And, my research has unfortunately been interrupted by COVID-19, but Mathematica staff has been extremely helpful in troubleshooting and developing workarounds for my process. So I'm really glad to be spending the summer here.
So before the interview last week, we talked just in preparation for today's discussion, and both of you conveyed your interest in applied public policy research. That was one of the reasons that you had decided to do the summer fellowship. I was wondering what it is about applied research that appeals to both of you. Sarah, do you want to start us off with that question?
Sure. So to get a little bit personal, I'm an empath who loves numbers. So for me, it's really about the potential for solving the practical problems we all see when we read the news and move around the world. When I worked in practice settings at a hospital and at a nonprofit, I always wanted to ensure that decision-making was guided by data and that program impacts were thought through in a systematic way. On the other hand, in academia, I've always asked myself, so what? How can this finding be translated to improve, my mom's life or my cousin's life or my neighbor's life? So applied research enables me to translate science into practice and use practice to guide avenues of research.
All right, great. And Rachel, what about you? What about applied research appeals to you?
Yeah, I think a lot of what Sarah said really resonated with me. From my perspective, and particularly in education policy, it seems to me there's no better way to ensure that your research is timely, reaches the appropriate audience, and has the highest chance to impact policy and practice than working in an applied research setting. I also saw from my time at TFA how hungry nonprofit leaders were for rigorous evidence and feedback and for the support of experts. And I saw how they wrestled with and ultimately incorporated research findings that were generated by evaluation partners. And so that collectively sort of informs my thinking around how applied research can work in support of these big public policy problems that many people within our society are working to address. And on a personal note, I love research, I love data, I love coding, and I love writing. And working in an applied policy research organization like a Mathematica would provide me with the best opportunity to geek out on research full time, whereas in other settings, it would be one component of my job and not really the full-time focus.
So one thing that struck me about both of your research topics is that they deal with racial disparities in public policy in some way, which, it's not, you obviously chose your topics before the summer of 2020 and have been working on this for a while, but they do feel especially relevant this year given the current national dialogue about structural racism and social injustice. And I think, Sarah, I think you mentioned social determinants of health, which I think is connected to structural racism. I was curious, how would you like to see your field, public policy research, contribute to solutions in addressing racial disparities, whether it's in K-12 education, healthcare, or other policy areas?
Yeah, this moment has brought to the forefront a lot of issues that I care deeply about. We see that COVID-19 is revealing and exacerbating long-standing and deeply rooted inequities in communities of color and laying bare the disparities in health stemming from structural racism. This is particularly important for my research about mental health because for communities of color who are being disproportionately affected by the pandemic, the need for timely and appropriate mental health care will be increased and barriers to care will be worsened. So, as I look to the future, my perspective is informed by a large body of health research about the impact of discrimination and inequities throughout the life course. We know that structural racism is baked into public policies and institutional practices in housing, education, and healthcare that harm people's health. With that understanding, I have a couple of thoughts about how I'd like to see policy research contribute to solutions. So first, while the impacts of structural racism are implicit in the research many agencies do, racial disparities figure prominently into many analyses. I hope more agencies commit to giving structural racism explicit attention in their policy work, testing solutions to address it, and using and developing rigorous methodology to do so. There was a descriptive analysis published in 2017 by Goodman and her colleagues about the health disparities literature, and it found that 93% of studies were what they considered first and second generation. These studies answered the questions, 1, do disparities exist? And 2, why do disparities exist? They found that only 5% of the total studies were considered third generation. These were studies that assessed, do interventions work to reduce disparities? So policy research can help answer that question. We have a sense of what many of the issues are. Now, how do we fix them? So my dissertation again asks, did this landmark policy do anything to ameliorate health disparities in mental health care? It wasn't designed to do that, but if that's one of the impacts, that would be an amazing thing. 2 additional thoughts. I think that policy research that acknowledges the contribution of non-health policies, economic policy, criminal justice policy, housing policy, research that acknowledges the contribution of these non-health policies to racial disparities will also be essential in addressing those disparities. And lastly, while I'm primarily a quantitative researcher, I hope to see increased investment in policy research conducted with, rather than on, communities. Research that incorporates community engaged and participatory methods.
Great. Rachel, what do you have to add? Anything else that you think the policy research field could do to contribute to solutions in addressing racial disparities?
Yeah, it's a really great question that caused me to think a lot about some reading I've been doing I believe there's an important role for our field to play in designing and testing policy solutions to address structural racism in our country. But I think in order for our field to do that well, a few things need to happen within our field before I think we're really ready to be outward facing and thinking about solutions collectively. Although there are many people leading great work thinking about solutions to address structural racism. And I also want to say I have 3 points I want to make, but before I make them, I want to just acknowledge that there's a lot of amazing scholars who've been leading work to push the policy research and education research communities towards confronting structural racism more adequately and appropriately. I know on this podcast, you all had Dr. Kilolo Kijazi at the Urban Institute. She co-authored, a great brief on this topic. And that's informed my work quite a bit and my thinking quite a bit. There's also Dr. Gloria Ladson-Billings, who's really pushed the education research community to consider how we treat a concept like race, and Drs. Prudence Carter and Russell Skiba, who have been pushing for recognition of racism and the role of racial disparities in discipline in order to adequately address them. And so I think 3 things need to happen in order for our field to be adequately addressing structural racism. First, I think there needs to be more of a clear and consistent recognition of the role of racism and discrimination in producing these policy problems we want to develop solutions to address. And so I say that just to expand on that. I think that there is a hesitancy, and I've observed it and I've read hesitancies to name the problem. And the problem here is structural racism. And I think that's driven in part by the heavy influence of the field of economics and policy research. And traditional models in economics set a pretty high and probably unreachable bar for what quote unquote causal evidence would look like to prove that racism and discrimination are causing racial disparities. And lots of education and policy researchers and policy researchers more broadly are still largely informed by these more traditional frameworks. I've seen a lot of people ask for, is there causal evidence that discrimination is what's driving it? And I think that hinders our ability to name the problem. Relatedly, I think that this lack of naming the problem of structural racism is driven in part by a lack of understanding and knowledge as to what structural racism is and how it operates. For example, in many public policy graduate schools, there is not a requirement for coursework on anything related to racial equity or systems of oppression. I know that was certainly true in both of my graduate school endeavors. I have a master's in public administration from NYU's Wagner School, and I am at Pardee Rand's graduate school. And so I think that this ultimately results in many policy researchers who end up doing work on racial disparities who don't know the full history of racist policies in the context that they're studying. And I think altogether, this lack of a clear recognition of structural racism and being the cause of these policy problems we care to address leads to us, one, not understanding these problems very well, but also in designing solutions that are not addressing the root causes. And so I think that that's a big, important first step. I think second, and Sarah mentioned this a bit, we need to pay closer attention to the data and methods we're using to diagnose and understand racial disparities. And here, as someone who uses quantitative data and methods primarily, I'm talking mostly about people who use quantitative data and methods. Often the data and methods we're using are insufficient, if not outright inappropriate, to address these research questions. So I have as an example, the school discipline literature. One of the main problems in studying discipline disparities is the data we're using. And so all information on school discipline infractions and resulting penalties is generated by teachers and administrators. And so if there's any bias in which students are chosen to be written up for an infraction, so in other words, what behavior is labeled as disrespect or disobedience, and if there's any bias in how behaviors are categorized and labeled, the data that we're going to use to study racial discipline disparities is biased to start. We've got some really large problems that we need to think hard about and reconcile with before we can go about running some models. And there are some really smart folks, including a group of professors at Princeton, working on developing methods to account for data issues like this one. But the larger point here that I want to raise is that we need to be more thoughtful both about the data generating process and the methods we're using to answer certain research questions, because research using really imperfect data can often do more harm than good. And then finally, we all need to be working harder and faster to diversify our field. Policy researchers have a huge influence on the policymaking community, and yet the policy research community remains overwhelmingly white and male. And I think to do good policy research, especially policy research that is going to impact the lives of Black and Latinx folks and individuals from low-income communities, we need far more people at the table engaged in research who share some aspects of those lived experiences.
Thanks again to our guests, Sarah Lieff and Rachel Perera. And thank you for listening to another episode of On the Evidence, the Mathematica podcast. If you found this conversation useful, please consider leaving us a rating and review on iTunes. Another way you can help the show is by subscribing on your podcasting platform of choice. We're on Apple Podcasts, Spotify, Stitcher, and elsewhere. You can also keep up with the show, as well as other interesting work from Mathematica, by following us on Twitter. I'm at JB Wogan. Mathematica is at Mathematica Now.